My name is Brian Pangle. I am the president and CEO of Clark. And on behalf of Clark, Holland Home, and the 39 other sponsors and supporters of this event, I want to welcome you to the first ever Rethinking Dementia, Accelerating Change Summit. Just a couple of housekeeping items. As you walked in, you saw restrooms to our left out there. And so that's where you can use restrooms. And also, this is being broadcast and live streamed today. So if you could turn your cell phones to vibrate or off, we would really appreciate that very much. Our journey toward today's summit began more than 18 months ago when Jim Nicholas, caregiver and spouse to Georgia, a resident living with dementia at Clark, challenged and funded us to search out and investigate the foremost organizations and thought leaders from around the U.S. and bring their knowledge, insight, and expertise to bear here in West Michigan. Please join me in thanking Jim for his leadership and generosity. So today is about envisioning, innovating, and accelerating change through this strategic community-wide conversation. I want to thank our impressive panel of thought leaders who have joined us from across the United States, along with our own thought leaders and experts right here in West Michigan. You'll get to meet and hear from them. You'll get to meet and hear from them all throughout the day as they help us envision what it means to be dementia-friendly and so much more in our communities. Innovation is often the result of asking why. If you ask why often enough, you usually get to what. These are the organizations that have said, we want to help with the why, what, and how. All of them, in their own right, are innovators that have said yes to this summit and perhaps well beyond. Please join me in thanking them for their support today. Collective impact is the approach we have chosen to facilitate the change we are envisioning with this summit. At the core, this model is about collaboration. As we rethink dementia and accelerate change, not one organization on its own, in this room or in this community for that matter, can affect the kind of change our communities will require. So this is about creating a shared vision that utilizes evidence-based data to coordinate actions and activities. We will rely on transparent, ongoing communication as well as support from our core organizations. Again, this is the approach we will utilize coming out of this summit today. Please join me in welcoming, via video, sent to us late last week, a longtime champion in the fight against Alzheimer's, Senator Debbie Stabenow.
Good evening. I wish I could be with you for this very important summit today. I want to say thanks to Brian Pangle as CEO and president of Clark Retirement Home, and to Jim Nichols. I know your wife Georgia is a resident at the Clark home, and I want to thank you for your wonderful support in the mission of improving dementia care, which is near and dear to my heart and to all of us this evening. I'm so glad you're getting together to talk about best practices and how to make a positive difference in the daily lives of our loved ones who suffer from some kind of dementia. Alzheimer's and dementia, as you know, is the 6th leading cause of death. 185,000 people, moms and dads, brothers, sisters, friends, husbands, wives in Michigan have been diagnosed, and many more are affected because if someone in your family has Alzheimer's or some kind of dementia, it really is a family disease. Everyone is impacted. And that's why we need to also care about the 15 million caregivers across our country. And that's really what my Hope for Alzheimer's Act is all about. First of all, this is a bill that includes all kinds of dementia disorders. But the legislation is, number one, an effort to encourage doctors to provide early diagnosis so that families and patients know what is happening, and then to ensure that families have access to care planning sessions with the doctor, with the healthcare providers, so that they can discuss treatment options and learn about the range of support services. And we know that more support is needed as time goes on. So it's important that families be empowered, be given a chance to figure out what would be helpful now, what they can look forward to, what kinds of planning they should be doing. All of this is very, very important. And it's a critical step to make sure that someone with Alzheimer's or another dementia is treated with compassion and the respect and care that they deserve. I'm very proud to support the HHS, the National Family Caregiver Support Program that assists those who care for loved ones at home, and there's so much more that we need to do together. In fact, it's amazing when I tell people that 1 out of every $5 spent by Medicare in our country is spent on Alzheimer's and other dementias. Just think about that, 1 out of every $5. So we need to be laser focused on these forms of diseases. And we also need to be spending more dollars on research. And I know that in Grand Rapids, I know that there's wonderful work, having met with researchers at Michigan State and hearing some of what's being done, that there are great opportunities for us to find opportunities for treatment and to ultimately find cures. But it involves all of us together being willing to push hard for the dollars that are necessary for the basic research that is so, so critical. I'm hopeful based on what I'm hearing, but we've got a lot of work to do and we need to stay committed together. But you know, it all starts with talking to each other. People coming together to share what we know, to learn from each other, and that's exactly what you've been doing today. So thanks very much for caring, for spending your time in this very important way, and I'm proud to be your partner. I hope you continue to have a great summit.
What better place could there be to hold a summit about rethinking dementia and accelerating change, but on a university campus, particularly one devoted to human medicine and research? Please join me in welcoming our Michigan State University College of Human Medicine host, Dr. Jack Lipton, Professor and Chair of Translational Science and Molecular Medicine. Jack?
Thanks very much. Pardon me while we do the swap here. All right, it's a special treat for you all today because I'm wearing a tie and real pants. So I hope you all know how special a day it is. Today I'm going to talk to you a little bit about the work that we do. But before I do that, I want to make sure to welcome all of you as the host institution for this summit. I've welcomed warm welcome from Dean Rapley from the College of Human Medicine and the president of Michigan State University, Luana Simon. We're all excited that you're here. And the reason that I was asked to give, usually it's people above my pay grade that give the welcome when they're acting as a host institution. But the reason that I was asked by Brian was because of the work that we do. So this is the headquarters for the College of Human Medicine here in Grand Rapids. And I'm the department chair of Translational Science and Molecular Medicine, as Brian said, which is kind of a mouthful. So let me go through exactly what that is. So most people ask me, what is translational science and molecular medicine? In fact, someone just asked me that about 10 minutes ago, and I said, stay tuned. So what is translational science? Translational science is discoveries that can be translated to practical applications. This is the idea of taking things from the laboratory bench and moving them to the bedside. Now, this is a dynamic process. This is not a one-way street. So we, as scientists, and the reason that several of my scientists are here, are to listen to what's going on in the community, what are the needs as it relates to dementia and neurodegenerative disease, and we can take those ideas from the community back into the laboratory and prioritize different types of research. So as you can see here, this has a cycle of bench to bedside, but the community is very important. Without the community, we don't necessarily know what those priorities are. And what is molecular medicine? Sounds fancy. That's the study of fundamental molecular processes of biology to understand and treat diseases, and that's what the faculty in our department do. So they work on the basic ideas behind the etiology of the disease and the treatment of the disease. So what diseases do we study in translational science and molecular medicine? Alzheimer's disease and other tauopathies, so other diseases that have a similar neuropathologic profile to Alzheimer's disease. We study Parkinson's disease, and half of Parkinson's patients often have some type of cognitive impairment or dementia. And traumatic brain injury, which can also lead to dementia in the long term. What is our mission as a department? We're part of a community-based medical school. So it's very important for us to engage with the community and beyond the research that we do. So what we do is we act as a catalyst for clinical, basic, and translational neuroscience. Our goal is to improve the lives of those suffering from neurodegenerative diseases with the idea of taking the research that we do and moving them towards therapeutics. Educating the next generation of scientists, which I think is a really important aspect of what we do. And explain the value of biomedical research to the community. We spend a lot of time going out into the communities, and before I came to Michigan State University, I spent most of my time in a laboratory. But when I came here, and the people, all of our faculty who have come here, understand the social contract that we have in terms of explaining what we do, what the value is to the community, so that they can help us advocate for the things that we all need in terms of advancing with respect to dementia and other types of neurodegenerative diseases. We also want to, through that community interaction, is to encourage participation in clinical trials and specimen donation, which is an important aspect of what we're trying to do. And then just to give you a quick idea of the investment that we've given in West Michigan here. We started in 2009 here as a department with 2 investigators. We're now 10 labs, and this is a part of our growth you can see here in terms of the number of researchers that we have working here in 10 independent laboratories. And we are ganging up on neurodegenerative diseases as part of our new ad campaign. It's on our website, looks very nice. We've been designated as a Udall Center, which is a Parkinson's disease center of excellence from 2010 through 2015. We have, with some of our faculty that are here today, they're part of an NIH-funded Alzheimer's disease program project, so we interact with other institutions, including the Barrow Neurological Institute in Arizona. And we've had over $13 million in grant awards in support of age-related neurodegenerative disease research. So we're doing a lot of work here in West Michigan, hopefully for the country. And we just want you to know that there's a lot of investment here and a lot of interest in Alzheimer's disease. The 3 laboratories that we have currently, some of these people are here. Wave over there, Nick. So Nicholas Kanan is a tau protein biology specialist, and he studies the mechanisms of degeneration in Alzheimer's disease. Scott Counts studies the selective neurodegeneration. There he is over there next to him. Studies a selective population of neurons that become vulnerable and is interested in understanding how people move from mild cognitive impairment to Alzheimer's disease. And Irving Vega, who's one of our newest faculty members right down here, also is interested in tau protein and the mechanisms of neurodegeneration and the other proteins that are involved in developing the neuropathological issues that happen in Alzheimer's disease. So what's coming next? We're planning to continue to invest. We're going to have more faculty, and I think that the results of this summit will tell us what kinds of things we really need to concentrate on as we begin to recruit new people. And if you want to stay tuned, if you look out that window at some point, you'll see there's a giant hole in the ground, and our new building will be going up there very soon with the groundbreaking coming next week. So welcome, and we're here to learn from you more than tell you what we know. And we're hoping to take that back and have some real value with respect to the things that we can work on in the next few years. So thank you very much.